What's up, guys? Holden here at H-Bomb Fitness. Today I want to show you a few things you can do if you know that your hips are kind of tweaked out. And I mean, my main suggestion is if you can kind of feel a slight malalignment in your hips, I would suggest going to a physical therapist, specifically a orthopedic certified one. They do an amazing job of correcting hips and getting all that stuff back in alignment. But there are a few kind of home remedy things you can do. However, I wouldn't recommend it to be the cure-all for all that stuff. But there are some kind of preventative measures you can do and things to kind of alleviate pain. But the reason why I want to talk about this is basically when your hips are kind of out of alignment, basically it throws off the whole connect chain, going all the way up to your spine and your neck, and going all the way down to your feet. Okay, and so what happens is we can get kind of two different things. We can get a posterior pelvic tilt, so going back. So if you have your two pelvic bones here, you have a posterior pelvic tilt, one's going back, and we can have an anterior pelvic tilt, one going forward. And so there are different combinations of all this. So for example, when I had an anterior pelvic tilt on my left side and a posterior pelvic tilt on my right. So it's kind of like that. So if you think about having that and then having your femurs adjusting to that, then everything has to adjust to get back to that alignment. And your body is very resilient. You know, when you have something like this, it doesn't mean you can't move or function or do anything. It just means things aren't working as optimally. Okay, so then there's that. You can have the opposite. You could have anterior and posterior, posterior, anterior. Also, there's another thing called medial flare and lateral flare. So that's your pelvis. It can medially rotate inward or laterally rotate outward. Okay, and now we can get combinations of all of that. Okay, so we can have a medial rotation with a slight anterior pelvic tilt. We can have a medial rotation with a posterior pelvic tilt, lateral rotation with anterior, all this kind of stuff. It's a little complicated, and a lot of physical therapy right now is figuring out what actually causes a lot of that stuff. Obviously, sitting, the shoes you wear, your overall mechanics of jumping, walking. But the nice thing about this is we can correct it. Okay, and I'm not talking about chiropractic adjustments where you're lying on your side and just pop you. I'm talking about muscle energy techniques. Okay, so this is a type of physical therapy treatment that's extremely useful, and I've had it on me, and it's fucking awesome. Okay, so basically what the muscle energy techniques is we are going to use our muscles to put your bones back in alignment. So you can do this for all parts of your body, but hip is probably the most important joint, I think. Okay, so basically we're going to use our muscles to have an extreme isometric contraction that actually does a little adjustment in our body. So if you think about if I'm resisting my bicep, it's all the resistance I can, we can actually get some change in the insertion up in our shoulder and our elbow joint, our radial ulnar joint. Okay, also our humeral radial ulnar joint right here. So this really extreme contraction kind of pulls on those bones and actually creates a little adjustment, shifts it. So now we're going to do for our hip. Okay, so this is going to be kind of a longish video, so please bear with me. Okay, it's okay, guys. My dog's over there. So, first thing we're going to do is correct a posterior pelvic tilt. Okay, so if you have a posterior pelvic tilt, what we have to do is anteriorly contract. Okay, so what you're going to do is literally just resist extreme flexion. So you're going to put your hand right here and you're going to contract with all your force that way. Okay, so you only could do this for like 5 seconds because you use so much energy to do this, but it's really important that you do a few reps of this. Okay, so posterior pelvic tilt, we want to get anteriorly, so you do this, you resist. You might get a few pops in there too. Okay, now anterior pelvic tilt, so that way, so we want to happen is we want to get back to a posterior. So for this you can use a towel, wrap it around your leg, and you're going to resist hip extension. Okay, so you guys see that? So put the towel here, resisting hip extension. So I'm trying to use my glute, but I'm holding it with the towel. So that's for the anterior and posterior pelvic tilt. Okay, now we're going to do the medial lateral flare. Okay, so for medial, put your leg up here like this, cross-legged, and we are going to resist. It's kind of, for this sake, we'll just say resist hip flexion, even though since we're rotating our hips, we're getting external and internal rotation. So we're just going to resist hip flexion in this position. So have this, and then you're going to drive your leg this way and resist. Okay, now for lateral, take the towel again, same position, but now we're going to resist hip extension. Okay, so you're going to extend and hold it. So those are the 4 main things you can do, and so it's really important to do all of these exercises on both sides. The reason for that is, we're not experts, so we don't exactly know what is going on, but you can kind of tell if you have a posterior anterior pelvic tilt, and usually with those the medial and lateral rotation occurs. So for the sake of these exercises, it's good to just do all of them, so you're kind of resetting everything. Even if you don't have like a medial rotation, we're just going to do it to correct it. The important thing is to do all these exercises on both sides. Okay, just because you don't want to just do one side and then get kind of tweaked out. Alright, so there you go, guys.